In this lesson, I will discuss about submandibular space infection or Ludwig angina. The submandibular space is bounded anteriorly and laterally by the mandible, medially by the anterior belly of the digastric muscles, superiorly by the mylohyoid muscle, and inferiorly by the hyoid bone. The contents of the submandibular space is lymph nodes and anterior jugular vein. When we see the communication of submandibular space, medially and anteriorly it communicates to the submental space, posteriorly and superiorly to the sublingual space, and inferiorly to the lateral pharyngeal space. So infection from the submandibular space can spread to those areas. Submandibular space infection or Ludwig's angina is a serious infection involving the submandibular, sublingual, and the submental space bilaterally. The condition usually develops from an odontogenic infection, especially of the second research mandibular molars. Contributing factors may include poor dental hygiene, tooth extraction, and the trauma, such as fracture of the mandible, laceration of the floor of the mouth. Submandibular space infection is a polymicrobial cellulitis. The organisms most often isolated in patients with the disorder are strep, Viridians, and the Staphylococcus. But anaerobes also are frequently involved, including bacteroids, Streptococcus and the Peptococcus, and also fusiform bacilli and the diphtheroids. Early manifestation of submandibular space infection are pain in any involved teeth with severe, tender, localized submental and sublingual induration. Drooling, trismus, dysphagia, stridor caused by laryngeal edema and elevation of the posterior tongue against the palate might be present. Fever, chills, and tachycardia are usually present as well. The condition can cause airway obstruction within the house and does so more often than do other neck infections. Regarding investigations, high index of suspicion is important when diagnosing a deep neck space infection. Ultrasound is a useful technique for detection of nodules of parotid and the submandibular glands. CT with contrast is the imaging modality of choice for diagnosis of deep neck space infection. Blood culture should be obtained in the patients exhibiting bacteremia or sepsis. Treatment of submandibular space infection include maintenance of airway patency, surgical incision and drainage, and antibiotics. Maintaining airway patency is of highest priority because swelling makes oral endotracheal intubation difficult. So fiber optic nasotracheal intubation must be needed. Patients without immediate need for intubation require intense observation, and some patients require tracheotomy. Incision and drainage with placement of drains deep into the mylohyoid muscles relieves the pressure. Antibiotics should be chosen to cover both oral anaerobes and aerobes, such as clindamycin, ampicillin sulbactam, and ceftriaxone with anaerobic coverage. Adequate hydration and the pain management is also important. Thank you for watching.